Hi, my name is Arun from Charles Institute. In this video, I'm going to talk about a very important topic for DHA HAAD Prometric Exam. Not only for these exams, this topic is really important for all central government and state government exams. Okay, it's pediatric vaccination schedule from 0 to 6 years. At least one question you can expect from this topic for all these exams. Okay, so this topic is really important. So let's dive into the session now. So let's discuss the vaccines given at birth, at 2 months, 4 months, 6 months, 12 to 18 months and 4 to 6 years. Okay, so in this video, I know it's very difficult to remember the names of vaccines given at this specific time. So we'll be discussing some tips and strategies, some mnemonic that will easily help you remember the vaccines names. Okay, so let's start. Just remember this point. This is a repeatedly asking question. The vaccine given at birth. Okay, so let me write the name of the vaccine given at birth here. It's hepatitis B. So this is a repeatedly asking question for many exams. The vaccine given at birth is hepatitis B, for hepatitis B virus. Okay, this is a really important question. And the vaccines which are given from at 2 months. Okay, so let me separate this. The vaccine given at 2 months are hepatitis B, Hib vaccine, DTP, which is diphtheria, tetanus and pertussis, polio, PCV, pneumococcal vaccine and rotavirus vaccine. So these are the 1, 2, 3, 4, 5, 6 vaccines given at 2 months. Okay, now how do we remember these 5 vaccines? Okay, so we have a strategy to remember these vaccines. Okay, so let me explain you that strategy to remember the name of the vaccines. So just remember this mnemonic: hummingbirds, hip, detached, due to polio, and you give PCV after review. Okay, just remember this mnemonic. What is that? Hummingbirds, hip, detached, due to polio. PCV was given after the review. This hummingbird is hepatitis B, the first vaccine, hepatitis B. Hib vaccine, okay, Hib vaccine, which is Haemophilus influenza type B. Detached, DTP, this is how we remember, the diphtheria, tetanus and pertussis. Detached due to polio. Polio is the next vaccine. And PCV, this is pneumococcal vaccine. And finally rotavirus. Okay, so 1, 2, 3, 4, 5, 6 vaccines. Yes, there are 6 vaccines given at 2 months, and this is how we remember them easily, right? So next is 4 months. It's super easy to remember the vaccines given at 4 months, because the reason is why they are so easy to remember, because just you remove this hepatitis B from this list. Just the vaccines given at 2 months are all these 6. From that list, you just remove the hepatitis B and write all the other vaccines. Hib vaccine, DTPA, so DTP vaccine, polio, PCV and rotavirus. So this is how we remember the vaccines given at 4 months. 1, 2, 3, 4, 5. These 5 vaccines are given at 4 months. Now coming to the 6 months, again it's easy to remember because the vaccines given at 6 months of age is exactly similar to the vaccines given at 2 months. Okay, so just copy all the 6 vaccines here, that's all. So let me write them down here. Hepatitis B, Hib vaccine, DTP, polio, PCV, and finally we have the rotavirus. So these are the 6 vaccines given at 6 months, so easy to remember. Now 12 months, the vaccines given at 12 months of age, let me write them down here. They are one by one. The first vaccine is MMR, okay, DTP, third vaccine is chickenpox, which is varicella chickenpox, okay. So we have PCV and hepatitis A. 2 doses. First dose of hepatitis A is given at 12 months usually, and the second dose is given at 18 months. So 2 doses of hepatitis A against hepatitis A virus, MMR, DTP, chickenpox, PCV, and hepatitis A. And how do we remember it? So let's remember the strategy to remember these 5 vaccines given at 12 to 18 months. So this is a strategy. Just remember this mnemonic: my mother is resting. My mother is resting because of chickenpox and detached hip. I give PCV, she said ha. Just remember it in this way. So I have to include one more vaccine here, so remember it now. It's Hib vaccine, Haemophilus influenza type B. So there are 6 vaccines, not 5. And how do we remember them? My mother is resting because of chickenpox and detached hip. PCV was given and she said ha. She was okay and she said ha. This is how we remember it, okay. So my mother is resting is MMR, chickenpox vaccine which is varicella, detached is DTP, Hib vaccine, okay, so it's written here, and the hepatitis A. There are 2 doses, one at 12 months, second dose is at 18 months, okay. So the vaccine is given at 12 to 18 months. And finally the vaccine given at 4 to 6 years. The vaccines given at 4 to 6 years are DTP, MMR, polio, and varicella, which is again chickenpox vaccine. How do we remember it? How do we easily remember the 4 vaccines given at 4 to 6 years? So this is the strategy here. The strategy we have here is diabetes mellitus. We know diabetes mellitus can cause 3 P's. Okay, remember those P's, right? P's. And diabetes mellitus, we know it can cause vaginitis. So just remember it in this way. D stands for DTP, M stands for MMR, P is polio, and V is vaginitis. Okay, so these are the 4 vaccines given at 4 to 6 years, right? So believe me, there is an increased chance of at least one question for all these exams. Like I said before, for all these exams there is one question you can at least expect from this topic, vaccination schedule. Okay, so let's move on to the route of administration of these vaccines. Okay, so the vaccine given at birth, hepatitis A, this is injected intramuscularly, and Hib vaccine again intramuscular, diphtheria, tetanus, and pertussis intramuscular. Polio vaccine is given orally or intramuscularly. Okay, so there are injectable polio vaccines which are inactivated, we call it IPV, and OPV is active vaccine which is a live vaccine given orally. PCV is intramuscular, rotavirus is oral, and the vaccine MMR vaccine is given subcutaneously. Okay, chickenpox subcutaneous, and yes, that's it. So we have discussed the route of administration as well. Now let's discuss both killed and live vaccines. Okay, so the list of killed vaccines and live vaccines. So the killed vaccines are hip vaccine, this is killed, and we have the hepatitis vaccines, hepatitis A. Both hepatitis A and hepatitis B are killed vaccines. We have pertussis vaccine. Pertussis vaccine is killed, and rabies. The cholera vaccine, flu vaccine, which is given